Greetings, I am Madhav Kasidakna from Mass Communication Department of Banaras Hindu University. Today we are going to interview Dr Mrinali Deerpaul, who is doing intern in Mbbs from IMS BHU. Good evening, doctor.
Good evening.
We would like to have an introduction about your medical journey in IMS BHU as a student.
Yes, for sure. Medical journey for me has been very difficult as a student because I had to adapt. I came from Mauritius to come to India, which was a very great, huge change for me. And but I'm really happy because the knowledge that you get here is another thing, is another level. So, and continuously working for 5 years, continuously slugging and everything, and it was just like 5 complete years of penance and hard work.
Jaundice today in India is an underlying disease which has been titled. So we have our Dr Mrinali, who is going to talk about this disease, which is particularly in India, where many people are suffering from it, but they are underlying it. So doctor, may we know about jaundice more?
Yes, in fact jaundice, it is the yellowish discoloration of the skin and of the mucous membranes. These are membranes below the skin, beneath the skin. So the first sign of jaundice is that you will be seeing it first in your eyeball, the whitish part of your eye, which is known as the sclera, because the sclera has the greatest affinity for the pigment that is deposited in your eyeball, due to which jaundice occurs. So let's talk about the normal physiology of jaundice. In fact, our hemoglobin, in simple terms, our red blood cells contain hemoglobin. When the RBCs get destroyed after 120 days of their normal lifespan, the heme is released, from which heme is released, and it is converted into biliverdin, and that biliverdin is a green pigment. This biliverdin is then converted into bilirubin, which is a yellow pigment. This is the pigment that is deposited in your body parts. Now your bilirubin can be unconjugated or conjugated. That means unconjugated means it is still lipid, so it is not water soluble. So the bilirubin is still water soluble before the liver, before it enters the liver, and as soon as it enters the liver, it gets conjugated in the liver. In simpler terms, you can say that it gets converted into being a water soluble component, so that it gets excreted out of your body. But in jaundice, what occurs really is that either there is a problem before the liver, which is known as a prehepatic cause of jaundice, or a problem in the liver, which is a hepatic cause, and post-hepatic, after the liver.
So, like, our viewers have gotten insight about the jaundice. What is it exactly? So, what is the causes of jaundice? We would like to know.
Yes, as I've said earlier, if we talk about it has the causes are broadly classified into 3 main categories: prehepatic, hepatic, and post-hepatic. So the prehepatic causes will be causes before the liver. For example, some kinds of anemia, like sickle cell anemia. Sickle cell anemia is a condition, it is in fact a genetic condition in which your RBC's shape is not like it used to be. It is sickle shaped. So that's why it tends to get destroyed earlier. So that's why more bilirubin is accumulated. And other causes are also there, like main are sickle cell anemia and some other kinds of anemia also, in which the RBCs get destroyed earlier. Then if you talk about the hepatic causes are mainly liver, like hepatitis. Hepatitis is an inflammation of the liver. Cirrhosis. Liver cirrhosis is a condition in alcoholics where they drink so much, and that degenerates the liver completely. So it's a form of chronic liver disease. And other causes like some amoeba, like schistosomiasis, or some parasites. So these all are ascariasis, lumbricoids. These are also causes of hepatic causes of jaundice. And then afterwards if we talk about the post-hepatic causes. Post-hepatic causes these causes refer to as the bile gets conjugated, as I told earlier. It gets metabolized into water soluble. Then throughout its transport from the liver to the bile duct and to the gallbladder, where it gets stored as in the form of bile. So in that transport there is some obstruction, that like bile duct obstruction, like gallstones. These are the most common causes of jaundice here.
As mentioned by the doctor, the causes of jaundice may be hepatic, prehepatic and post-hepatic. Therefore, we would like to know the symptoms which a person can know if he has or she has got jaundice. Doctor.
Yes, as mentioned by Madhav, the symptoms are also based on its causes. So if it is a prehepatic cause, for example, if it is due to anemia and anything of other prehepatic causes, so the prehepatic causes will be defined, characterized by prodromal symptoms. What is the meaning of prodromal symptoms? It is it refers to generalized symptoms, like some before specific symptoms arise. The general symptoms like fever, weakness, lethargy, these are known as prodromal symptoms. So in prehepatic causes of jaundice, you will get prodromal symptoms. As I said, I'll repeat: the fever, lethargy, malaise, and weakness and everything. Then after these prodromal symptoms, then you will get a set of specific symptoms. You will get that jaundice. You will be getting that yellowish discoloration. In fact, it is very difficult for layman people to identify that type of color, because the color also differs. In prehepatic, it's mainly like it has a greenish tinge of yellow, which is your jaundice will be visualized first. Will be seen, like I said earlier, it will be seen over the sclera. That is the whitish portion, and that is seen by the doctor as you have to raise your upper eyelid so that you can see, you visualize jaundice. And then afterwards the jaundice progresses from up to down. Then it starts progressing towards the body, the whole body. It will involve the body. The body in fact gets yellowish, and then finally it gets to the palms and the soles. So in neonates it's very different. If I talk about the bilirubin level, where clinically it is seen, jaundice is seen, is more than 2.5 mg per dl in adults, and in neonates, in infants, it is more than 5 milligram per dl, where jaundice is clinically seen. You will be seeing it after those levels. So I'm sorry, Madhav, I have said about the diagnosis also a bit in the symptoms, but I'll continue with the symptoms.
Yes.
Prehepatic is over. Then I'll continue with hepatic causes. The hepatic causes will be, the symptoms of the hepatic causes will be depending on which disease has caused the jaundice. Like in hepatitis, you will be getting fever, nausea, vomiting. You will be getting anorexia. Anorexia means you don't want to eat. You will getting loss of appetite. You will be getting fever, and main is the jaundice that you will be seeing over. And same for then hepatic causes is over, and then let's talk about the post-hepatic jaundice, which is also known as obstructive jaundice. If doctors are seeing me, they will be knowing the term, the definition. They will be understanding it better. In fact, in obstructive jaundice, like in post-hepatic jaundice, you will be seeing specific characteristics like pale urine. The urine will be discolored, will be like, you will be asking them, it will be like, you will be telling the patient will say that, wo sarson ke tel ki tarah tha. It was, the patient say like that. It stains the toilet, the pan of the the toilet. Also, you will be getting discoloration, clay colored stools. The stools also get discolored. Clay colored, or you can say pale colored. They will be saying that stools matlab latrine ka koi rang nahi tha. So that's kind of what patients say. These are the two main symptoms, and in post-hepatic jaundice, the main or characteristic feature, you will be getting pruritus. Pruritus means itching all over the body. Itching occurs because due to the bile salts which get deposited under your skin, that irritates your nerve endings, and then you will be seeing a patient itching continuously. That's a very diagnostic feature of post-hepatic jaundice, obstructive jaundice.
So we have got the symptoms of jaundice where common people, like a common man, can also relate to himself if he's getting pale, stools, like yellowish urine or discoloration on the skin and yellow tinge. So this is the symptoms which normally a person can get to know if he has jaundice. Then he can get diagnosed in the hospital also. So he get confirmed if he has jaundice really. So now we want to know how it is being managed, the disease, the cure which is being done for the patients. Many people believe that jaundice is a waterborne disease. How far do you agree with that?
In fact, that's a In fact, that's a great misconception. It's not like jaundice is a waterborne disease. It's in fact one of its causes, which is a waterborne disease, which leads to jaundice. So jaundice per se, it's not in itself a waterborne disease. For example, if we talk about jaundice, if we talk about hepatitis, which is a very main leading cause of jaundice in India. Hepatitis is mainly the most common cause of jaundice is the viruses. Hepatitis A, B, C, D and E viruses. These are the main most common causes against which there are vaccines under the National Immunization Schedule of India of Hep B, which I will recommend everybody, every parent. Okay, that will be coming on part of the management. Sorry for mixing issues again. Okay, so just remind me about the immunization. Yes, I was talking about waterborne diseases.
Waterborne disease.
Yes. So about the waterborne diseases, as I've said, it's hepatitis which is a waterborne disease, and in fact, hepatitis A and E. These are not these are these two are fecal-oral routes. They spread by fecal-oral routes, like in fact by water contamination also. But hepatitis B, C, D, these are spreading through blood, like blood transfusion, like IV drug abusers, like in these conditions. So mainly, if we talk about waterborne, it's hepatitis A and E, which are mainly waterborne diseases.
Thank you for confirming that jaundice is not a waterborne disease. So doctor, like how is jaundice being controlled, managed, or the cure procedures, how is this being done?
Okay. So like first we have to diagnose the jaundice, like by it, first it is, the doctor, once he sees the patient, he knows that this patient has jaundice, and through the symptoms, he can definitely know that if it is a pre-hepatic, hepatic or post-hepatic cause. But we have to do certain tests after confirming which cause because we have to do the tests, then we have to, through the tests, we will know which has led to the jaundice. Then from the test, then we will start the treatment. So what are the blood tests we do is a complete blood count. The first is which is a universal test. We have to do a complete blood count. We'll be seeing if the WBCs are raised, the white blood cells are raised, then you see that, and then you will be confirming that there is any kind of infections, and then we can suspect hepatitis. Then from that we can do a management, we can treat as per the hepatitis. We will be doing LFT, liver function tests, which is a very important test because that will show us whether the cause was pre-hepatic, hepatic or post-hepatic, as I said. So through LFT, we will be seeing the levels of enzymes, that depends. Some enzymes that get deranged, that get elevated, show another kind of cause, and some others show a different kind of cause. So that I won't go into details of that. Then afterwards we will be doing a USG, I mean an ultrasound. We will be looking for any liver enlargement so that we can see that there is a hepatic cause or not. We will be excluding gallstones. If there is gallstones, that will be visible in the ultrasound, and other radiological assays like that. We will be doing CRP levels also, which shows inflammation level. So after that, after doing those tests, we will be going to our management. So we will be managing likewise. So if we have seen that it's a pre-hepatic cause like anemia and sickle cell disease, we will be treating accordingly. So sickle cell disease is very complicated, and I won't go into details about this because it's not so common in India. It's common, but not so common as I'll be going more in depth in the hepatic causes, because hepatitis is a very leading cause in India. So hepatitis, like I said, there is a first prevention. Mainly, like we say, prevention is better than cure. So in India, there have been that the hepatitis is such a severe condition that they have included hepatitis B vaccine under the NIS schedule, and NIS is National Immunization Schedule of India, under which NIS is something that every child, every infant that is born, is given all the vaccines as per the National Immunization Schedule. So as per the NIS, on day 0, as soon as the baby is born, he's administered Hep B vaccine. And then afterwards there are 6, 10, 14 weeks, 6 weeks, 10 weeks, 14 weeks, then he is given pentavalent vaccines, in which pentavalent there is diphtheria, pertussis, tetanus, and also Haemophilus influenzae B plus hepatitis B. So that also is given more as a booster doses. So, and under IAP guidelines, that's another guideline for immunization also, in which they have included hepatitis A vaccine also. So that's some new researches that have gone to prevent. Now, if you couldn't have prevented the hepatitis, if the adult is living in some hepatitis prone conditions, like, because here in poverty, you're living in poverty, social overcrowding, the diseases, the incidence tends to keep on increasing. So in those conditions, you have to you treat hepatitis. That also, the treatment is also based on which virus has caused it, because hepatitis C leads to chronic infections, hepatitis A, B, E, that leads to a bit acute infections. Acute means less time, chronic means taking more time. So we will be giving antivirals like that. Also, antivirals are not given everywhere, but we tend to control the symptoms by giving, first we will be giving antivirals, or we give supportive treatment like IV fluids or analgesics if the liver is painful, the liver has got enlarged, or if the person has not he didn't get treated after all these things, then you have to the definitive treatment is liver transplant. If the patient is still not, he didn't respond to any medical management like drugs or anything. Hepatitis E tends to affect pregnant females, so in which hepatitis A vaccine is given. For hepatitis B mainly it doesn't occur so much because we already give the vaccine in childhood itself. But also after the child has got child or adult, anyone who has got hepatitis B, he doesn't only get antiviral treatment. Antivirals like remdesivir and everything, these are some drugs, one kind of drug, but he also gets some like an immunization. He also gets an antibody. He's injected an antibody also. So that was main about hepatitis, the hepatic causes main. And liver cirrhosis is very, it's like a degenerative disease in alcoholics. So this shows that the liver has completely degenerated. So in these conditions, the definitive treatment is liver transplant. Then if you talk about the post-hepatic causes, mainly the post-hepatic causes gallstones. So we have to do a cholecystectomy, which is a surgery of removal of the stones from the gallbladder. And yeah, I guess that's it. I think I've covered many things.
So our viewers have got the insight about the prevention, which is definitely vaccine. Everyone should get the child vaccinated for the prevention of jaundice and hepatitis. And in case they have got the jaundice, there are antivirals like the fluids which you can take, or in serious cases they have to undergo surgery like liver surgery. So we thank you for your informations, doctor, for today, for giving us the opportunity.
Thank you, Madhav, for giving me this opportunity, because that has been a great experience for me.
We hope that our viewers will have a knowledge about the information you gave, and this will help the people. Thank you so much.
Thank you.